patient Lulu for her third session of AvaTX laser that targets acne scars, inflammation, rosacea, and 25 other more indications. So this is her third treatment. She's gotten some really good results. Her texture has greatly improved a lot, very smooth, but there's still some residual pigmentation like brown and red undertones. So before I start, I want to cleanse her face first with some witch hazel, making sure it's clean. She already washed her face. She was wearing a little bit of makeup coming into the office. So unfortunately, we had to ask her to remove that and clean her face, wash her face thoroughly. And so now I'm just cleansing it with witch hazel, making sure everything is clean and no residual makeup. So obviously for this particular wavelength, the 589 wavelength, it's a yellow light laser. It's very bright. We want our patient wearing shields, and obviously, as you can see, we're all wearing special glasses for it. So close your eyes for me. There you go. Okay, John, you're gonna step out. Bye-bye.
Yeah, I will in a second. I'm just gonna make sure the light's dead. Yeah, come here. You come here.
Okay.
Right there, your camera's in this slide, but you're fine. I'll just do this. Yeah, you're fine.
I'm gonna just apply the whole, her entire face so it's quicker. So I can just go, and you just wipe off. Okay.
Can you tell people the name of the treatment we're doing today, Pam?
The name of the treatment is called AvaTX Laser Light. It's a dual wavelength, 589 nanometer and a 1319 nanometer wavelength. It targets, it's actually 25 indications, and it's good for most skin tones.
Perfect.
Particularly for her, we are actually treating her acne and some acne scars. So the first pass, which is a 589 wavelength, will target or pick up mostly the redness and inflammation on her skin. And then the second pass will be the 1319 wavelength, and it will actually pick up the brown on her skin. So she's just gonna have an amazing skin after all these treatments. She's only had 2 treatments so far. This is her 3rd treatment. And you know, you could actually check our website for the before and afters, or our Instagram as well. Every picture, all of her pictures are posted in there, and she's got some amazing results. I can't say good enough things about this particular laser. It's a game changer. And the beauty of it all, it's no downtime. And I know before, when they say, oh, there's no downtime, and really most of those lasers doesn't really work, but this one truly does. Okay, Sam, look away.
You're right.
Turn your head to that side. Perfect. Lift you up a little bit. As you can tell too, you know, we can ask her after I start the treatment if there's some discomfort or pain, or you know, how she's feeling. You guys can ask her how she's feeling as I'm treating her, so you can really truly understand that this treatment and this laser really does what it tells us to do. There you go. See, as long as you're looking away, you don't really see it. If you see directly onto the handpiece, you'll see the railroad, but if you're looking away, it's actually pretty good. You okay, Lulu? Mm-hmm. Yes.
Is this a fractional laser, Pam?
It's not a fractional laser. It's actually a 589 wavelength. It's a light laser. So it's attracted mostly to the vascularities of the skin. It's not going to resurface the skin or ablate the skin at all. And that's why we don't need to numb patients and there is no downtime.
Lulu, people want to know what it feels like since you're squeezing the implants.
It just feels like just a little shock.
Is it like a prickly heat, kind of like a microneedle would heat?
Yeah, honestly.
So I've also done this treatment to myself, obviously not by myself, but another provider. And how I describe the feeling, it feels like if you've done microneedling before, it does feel like a microneedle, but it's like heated on the tips of the needle, and it's not continuous, so it's spread out. It's not too bad at all. To be honest, when I did this, I was telling the provider that, oh my gosh, I can actually fall asleep while doing this treatment.
And what is the machine called, Pam?
The machine is called Adva TX Laser Light.
Thank you.
It's a dual wavelength. The yellow light is a 589 wavelength. It targets all the red, like if you have rosacea. It actually helps with psoriasis as well. So anything that has to do with inflammation in your skin, it helps tremendously. And then for acne patients, particularly with our patient right now, what it does, it shrinks the sebaceous glands, and so it doesn't produce as much oil. And so if the patient is having like a breakout, like a massive breakout downtime, there really is no downtime. After the treatment, it's a little bit of pink or redness on the skin. It goes away in a couple of hours. And then the redness actually the next day will look diffuse or more of like pink. I'm gonna do more Lulu today, okay?
Mm-hmm.
Sam, if you don't mind, can I trouble you to get me some water?
Yeah.
My throat's starting to itch. Thank you.
Mm-hmm.
Excuse me. Feel sensitive there? Yeah. So she's telling me that's a little bit sensitive closer to the mid face. And normally it's like that when there's more targets on the face. So most of the time, our forehead, the T-zone area basically, the forehead, the nose, the chin, and a little bit on the mid face is more kind of like congested, and that's why the pore size is a little bit more enlarged. And that's the reason why when I do this particular treatment on those areas, it's more, you feel a little spiciness to it, but it's still tolerable. Straighten your head. Tilt you a little bit more.
Did you want me to start working?
I'm not yet, I'm not done with that side. Right.
Is there any smoke, residue, or plume from this laser?
No smoke at all. You don't really smell anything. You scary Lulu, huh? I'm gonna hit that.
No, it's okay.
This treatment is also not that long because since the patient doesn't need to numb, it takes about 30 to 45 minutes altogether for the full treatment of the full face. How does it feel on the nose, Karen?
It's you don't feel it as much as you feel it on the cheek.
Interesting, huh?
Yeah.
Right. So you can,
Are you good with what you shot?
be recorded, okay? Okay, now we can start whipping. Mm-hmm. No, not the chin and not the upper lip. Yeah, so you can just like wipe quick and then. Perfect. That way when I clean it later, it's not long. Mm-hmm. Alrighty, here we go. Okay. Hot, prickly.
Pam, before we end the live, can you let the new viewers know what this laser treats?
All right, so for everybody who's just tuning in, this laser is called AvaTX. It has 25 different indications. It treats mainly acne, inflammation, rosacea, telangiectasia, those spider veins, hemangiomas, scars. It also helps with like stretch marks or any type of scars that you may have. And then also at the same time, it helps treat melasma. The 1319 is mainly for that. And sunspots, scarring, texture, tone. So it's an all-around laser that is, you know, with minimal downtime, 4 to 6 treatment at least for the first few sessions. And then after that, just really maintain the skin and staying looking young.